Copyright disclaimer under Section 107 of the Copyright Act of 1976, allowances made for the fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is a use permitted by copyright statute that might otherwise be infringing nonprofit educational or personal use tips the balance in favor of fair. All topics are for entertainment purposes only. None of the information presented in this video or by B-Girl TV should be taken as fact. Every situation is based on personal experience. Pretty Image Boutique is located in the Centro Comercial de los Pueblos Mall, located in Panama City, just 15 minutes away from Tocumen Airport. We specialize in hair care, wig extensions, and much more. Come visit us. Welcome, guys. Welcome to today's live. I almost did not make it here, but I'm here. Before we get started, I want to make sure that you guys can hear me. So if you can hear me and if I'm crystal clear, make sure you leave it in the chat, just to let me know that that you can hear me. For the people that are tuning in on Instagram, please make your way down to YouTube because we are live on YouTube. And today we are talking about health in Panama versus the USA. And I know that there's a lot of misconceptions behind that. Okay. So before we get started, guys, can you hear me? Can you hear me? Can you hear me? Yeah, I just need to know if you guys can hear me so we could get bad boy started. I'm just gonna make a few announcements until you guys leave it in the chat and let me know if you can hear me. vgirltv.com, the mailing list, join the mailing list. Okay, join the list so you never miss an update or when we go live. I also have a couple of I have a vlog that's up. It went up yesterday, so if you haven't had an opportunity to check that out, make sure you check that out now. Perfect. Deb Hatcher. Yes, I can hear you. Okay, welcome to the live. I'm glad that you guys can hear me perfectly clear. All right, so the reason why I'm even talking about this, I have done a video on this topic before, but I didn't really go into depth because I know people don't really pay attention to things for too long. People lose focus a lot of times. So when I make my videos, I try not to go over 10 minutes. But in this live, I'm literally going to give you my personal opinion about healthcare in Panama versus the USA. The reason why I'm even talking about this again is because someone left a comment asking me this question, and I was like, you know what, this is actually a good topic to talk about during our live stream because it gives you guys an opportunity to ask questions as well. All right, so as you guys know, I have been living in Panama for the past 8 years. My oldest son was actually born in America, so I have experience with the healthcare system. Of course, I have experience with the healthcare system in the States. And then recently, I did have to go back to the States to have a surgery, right? And that goes to, I'm not saying that, all right, well, before we jump into that, right? So I will say this, okay? Panama is very much a country that if you can afford certain things, you get treated a certain way. It's a very, and this is just my opinion. I know a lot of people that would agree with me, okay? And most of the time when the people that come on my channel are people that want to hear the real deal, they want to know they want to know the truth. They don't want any sugarcoating, right? And I'm here to not sugarcoat anything. So I've said this before, and this is not my first time saying this. Panama is a very classist country. So if you have money and you can afford certain things, you will get treated better. And that's just the honesty of the situation, right? Now, when it comes to healthcare, it pretty pretty much works the same exact way. I have had experiences in the States where I've had private health insurance that I paid for with my job, insurance through my job, and I didn't feel that I actually got adequate services. So, for example, when I was pregnant with my son, obviously I gave birth in the States. And when I gave birth to my son, especially when it comes to birthing, I don't think that people really like bedside manner for me in the States giving birth to my son. It was definitely an experience to say the least. At the time I was so young, I didn't really know any better. But then when I came here, my experience giving birth with my daughter was so much different. I had an extremely positive experience having my daughter. I then realized that I wasn't treated properly or fairly um, the first time around. Okay, that just threw me off just now. Okay. Hold on a second, y'all. I didn't want to show that. All right. So anyway, so as far as my son was concerned, I didn't have a really good experience giving birth with my son. But when I gave birth with my daughter, I had a very pleasant experience. I'm talking from the medical care, from my doctor, to my prenatal care, to me actually giving birth. It was one of the best experiences that I have had between my son and my daughter. I would hands down say giving birth in Panama was the best decision that I've made. However, if I speak to some of my locals, like my friends that are local, just like local natives here in Panama, their experience will be completely different from my experience. Okay. Many of them will say that because this is the way how it works, guys. This is how it works. Um, all right, let me shut down this live. There are options for healthcare, and I'm not gonna. And a lot of these doctors that work in these public sectors, they do work in private sectors as well, and they have pretty amazing doctors. The problem is that when you are are seeking medical care in the public sector, it's extremely overcrowded, and this is just for the city. Okay, I don't know what it's like in areas that are like more in the interior, which would be like Boquete and those places. I am not sure. My experience is specifically dealing with the city. Many of them will say that they have experienced overcrowdedness. It takes forever to get a doctor's appointment. If you have a doctor's appointment, if you need an appointment urgently, you probably won't get another appointment until 2, 3, 4 months later. Um, and that is definitely with the public sector. Now, my experience with a private sector, I didn't have those experiences. I literally got my appointments on time. My They treated me like amazing. Hold on, guys. Amir's asking me about the baby's bottle. Yeah, sorry guys. Okay. Um, so their experience will be completely different from my experience. Now, when it comes to healthcare, there are literally two options for you. You can either pay as you go, which means that you see the doctor, you pay. But if you are a sickly person, that may not be the best option. And then the other option is through health insurance, where you're paying a monthly fee and you're covered, right? Hello, Mario. Hello, Alexis S. How are you guys doing? Um, Now, this is the thing, right? So, when I first came to Panama and I got health insurance, you obviously have to have a physical. You have to have a physical, unfortunately. And most of the times, if you have a existent medical condition, the insurance company probably more than likely will not cover you. Now, you can pay because it's so affordable, right? Healthcare in Panama is extremely affordable. However, it can be very costly if you are a person that you're constantly sick. It like adds up, right? So when I first came to Panama, I had health insurance, and then I was never using the health insurance. And then it came to a point where I was like, well, I don't need this. And then when I did need it, guys, that's when, you know, it got crazy. I had to have kidney stone removal surgery, and that cost me $5,000, okay, which you had to pay out of pocket for if you don't have insurance. And then on top of you paying the $5,000, you have to pay the anesthesiologist separately, which is $500. So I need you guys to keep this in mind, okay? It definitely adds up for someone who may not have $5,000 just hanging around there. I get it. The surgery in the States probably would be way more money, but $5,000, someone who may not have $5,000 just laying around is a lot of money. In just my personal opinion, I'm not rich. So $5,000 was a lot of money. Okay. And then that's when I decided, you know what, let me just go back to getting health insurance. Now, what happened was in between that time of me going back and getting the health insurance, the insurance company did pick back up. However, they didn't cover anything that had to do with any kidney stones, right? Which led me into why I had to go back to states to have my surgery. So recently during my pregnancy, I had kidney stones again, and I had to get them removed. I couldn't get them. I mean, I could have gotten them removed here in Panama, but it would have cost me another $5,000 plus $500 for your anesthesiologist because guess what? The insurance does not cover anesthesia. The insurance does not cover anesthesia, right? So you have to pay a $500 fee outside of whatever the actual surgery, right? So with that being said, it made sense for me to get insurance. However, when I needed to use the insurance, nothing wasn't covered, which is why I ended up having to going back to the States to have my surgery done. I went back to the States to have my surgery done, and I do have private health insurance as well. And I will say the same thing. My experience didn't really go too well. And I'm not saying that they treated me like crap. However, the follow-up skills was very bad. Okay. Um, and I don't want to say it had necessarily to do with the doctor. It had to do with the staff letting things fly through the radar. Um, and then versus my experience here, I feel like well, my experience, okay, when I had to have surgery here in Panama, the staff was they followed through. They contacted me, they called me, they were very diligent. But that could also just be because of the hospital that I went to. The average person that lives in Panama cannot go to Punta Pacifica Hospital. You understand what I'm saying? There's Punta Pacifica, there's San Fernando, which I don't like San Fernando Hospital. And this is the reason I don't like this hospital. It's one of the top. So it's Punta Pacifica, San Fernando, Hospital Nacional. Okay, those are the three top hospitals here in Panama. Oh, and Paitilla Hospital. Okay, those are the top hospitals that a lot of expats actually go to when they are sick. Me personally, I didn't like San Fernando Hospital because in order to be seen in the emergency at San Fernando Hospital, you have to pay your copay first. So that means that if you are on your deathbed, and for example, my copay to go to the emergency room was $500, right? No, at that time I didn't have insurance. No, I'm lying. I had to pay the $500 in the ER in order to be a doctor versus in the States. Even if you are sick, even if you don't have insurance, they still have to take you. I don't know about the treatment, but they still have to take you. In this particular case at that hospital, at the time I didn't have insurance and they wouldn't see me unless I paid the $500 at the ER. Then once you pay the $500 at the ER, whatever other costs that you accumulate, when you leave, you have to make sure that you pay as well. So it's not like in the States where it doesn't matter. You can see the hospital, you can go to the hospital, you can see the doctor, and then they'll bill you afterwards, right? Or, for certain people, if you are an immigrant, you can get well, in New York City, that is, you can apply for Medicaid. I know Medicaid is something that, especially for immigrants, is really only in the state of New York City, where they have all these different programs to help people, the uninsured people. So I don't know if you are in the comment section and if you live in their state, is that true for your state? Let me know in the comment section if that is the case, right? All right. So how did I go about getting my insurance? So I actually went through an insurance broker. This insurance broker is the same insurance broker that I use for my car insurance. He also for everything pretty much. We recommended him to a lot of people, and the company's called Branch Insurance. At the time, the owner, he did speak English, but now he's deceased. And his sister is running the company. There's a person that works there. His name is Anthony. That he speaks English as well, and he's been working there for a very long time, and that's who we go through as far as insurance, as far as getting insurance. And if we do have any questions regarding the insurance, he's always there to assist, and he's always there to answer any questions or any issues or whatever. He's always there. And that's why, because there's a lot of shady business with a lot of brokers here in Panama when it comes to insurance. So that's another thing that you guys need to be aware of when it comes to insurance brokers. A lot of times, some people could be real shady, real shady. But I have had that experience. I know people who have had that experience with brokers, and they just took their money and then did whatever else that they had no business doing. So it's important that if you decide to come to Panama and you are looking for health insurance, that you do your due diligence and act around. Don't just jump into the first thing that comes your way. Meet with other expats to find out if they have insurance and if they could refer you to a broker. I just referred you to one, Branch Insurance. And no, I'm not sponsored or getting paid for that plug, but I'm just giving it to you guys because I know for how much you guys look for me for information. Now, I do want to say that the insurance companies that are available here in Panama, for example, I have Blue Cross Blue Shield International, and Blue Cross Blue Shield International is supposed to be available for use in emergency purposes if you are abroad and you need insurance for whatever reason. They have you, right? Alex S says, we need to interview with an insurance agent. I got questions. The problem is with a lot of these insurance agents that I particularly know, their English is not that good. And so they're scared to come on the channel. Trust me, I tried. I'll try again. Pray for me, and hopefully they may want to come on. But because they feel intimidated, a lot of times people feel intimidated the English that we speak because they feel like they have an accent or that their English isn't good enough. So they get kind of like, scared. All right. All right. So I have Blue Cross Blue Shield. Okay. Blue Cross Blue Shield literally covers me, especially when it comes to having a baby at the time. It covered me anyway and everywhere, but again, they didn't cover my kidney stones because I had a pre-existing condition. So that's just a FYI. There is one insurance company that will actually cover you. And there, even if you have, if you're over the age of 65, also that's the thing to understand. A lot of insurance companies won't pick you up if you are over the age of 65. However, there is one insurance company that will pick you up, possibly, and they're called MAPFRE, MAPFRE. Okay, again, MAPFRE. Okay, but they only offer insurance for Panama. Now, I don't know how good that insurance is. I've only heard of it through other people, but it says that they have network doctors. Okay. I use Blue Cross Blue Shield because I'm able to have a wider variety of doctors. Now, another way that you can get insurance is if you happen to get a job locally, with the Panamanian government, or a local job, with a local business, most of the time they will pay something called seguro. And seguro is something that you would pay in the States, which would be like your social security, which will go into your insurance as well. Now they have specific clinics, sorry, that you can go to when you do pay seguro. However, you have to pay into the seguro for a certain time. It's 3 months for your seguro to kick in for you to start using it. However, if you go to one of the seguros clinics, it might not be the best experience for you because you will have to deal with um, long lines of people, um, lots of people. However, the cost is extremely low. And when I say extremely low, you could pay like 50 cents, a dollar, $2. However, you do have to deal with a lot more in order to get that. So that is just a FYI for you guys to keep in mind. Um, I am paying into insurance as well. However, I have never attempted to use it at one of those hospitals because every time, well, the one time that I did go, it was ridiculous. Like the line was ridiculously long. It's literally like if you were in the Kings County Hospital in the 1980s, okay? I don't know if you guys know about Killer County. Yeah. Before all these like um little clinics used to open up like those MedMDs and those little side clinics open up. People used to go to the emergency room to go if they to go to the hospital, right? Or if they needed to see a doctor, even if it wasn't something urgent. People used to go to the emergency room. Now they have a lot of urgent care facilities, which brings me to the other way um, to receive health care, which I will say prices have gone up. And prices have gone up. And the only reason why I know prices have gone up is because I just went through it, right? So there's these things that there's a lot of like clinics which you would consider an urgent care, right? A lot of the urgent cares are not 24 hours, but they are some that are 24 hours. Before the pandemic, going into urgent care and not using your insurance at all was $12. So if you had $12, you can go in to the urgent care and see a doctor. And that all depends. The prices definitely vary depending on what area you live in. But particularly my area, it was $12 to see a doctor. Um, and for the most part, the doctors were pretty diligent. It was just the front desk people that always just had attitudes, like horrible. Panama got problems with customer service. Anyhow, a thing that you should keep in mind is that a lot of times you do not need a prescription to get certain medications, right? You can literally just go into a pharmacy and tell the doctor you have, I mean, not the doctor, the pharmacist, hey, what can you give me for sinuses, or if I have this issue? For example, if a woman suffers from a yeast infection, okay, in the States, you need to get a prescription in order to get medication for that. I know it's CMI, but I'm trying to, you guys know. But here in Panama, you do not need a prescription to get medication for a yeast infection. I mean, yeah, they have like Monistat, but I'm talking about like the medical prescribed um, prescriptions. You don't need that here. For certain medications, you do not need a prescription. You can literally just go in the pharmacy and ask the pharmacist what they recommend, and you can get medication. Versus in the States, you need a prescription literally for everything. Okay. Other than if it's like your common cold and it's something over the counter. The only thing that you cannot buy over the counter here in Panama is like Percocets, and cannot buy antibiotics. But everything else you can buy over the counter. Okay. And your insurance doesn't cover medication. You have to pay the medication out of pocket. Now, as far as the urgent care, because I kind of skipped over that, the urgent care was $12. And then when you see the doctor, if you need to get labs done, you have to pay for the labs separately. Okay, so once you pay your $12 and you see, that's only for the consultation, guys. For you to consult with the doctor, you have to pay a fee. Then after that, you have to pay for any lab work that needs to be done. Once the lab work gets back, the doctor sees, whatever the issue is, prescribe you medication, and then you have to go to the pharmacy and purchase the medication, which is not covered by your health insurance. Now, my health insurance says that I can get a discount at a specific pharmacy. I have never went to that pharmacy ever. However, the prescriptions aren't really that much money. Okay. Literally, the prescriptions are not that much money. And they're way cheaper than they are in the US. Okay. Way cheaper medication. And I'm not even gonna lie to you. Panama has some really good medications. Okay. I know a lot of people have told, like, I know one person is like, oh my God, I don't know. But Panama really has good medications. I don't know why people feel like in America is best. Like, don't get me wrong, America has, good qualities, but Panama has really good qualities as well. Um, I think health insurance would be a good idea for me. Should I live? Yes, definitely. I would recommend to everyone, if you can, to get health insurance because, you know, again, it happened to me where I decided that I no longer wanted to get health insurance and I didn't want to pay for it anymore because I wasn't using it and I felt like it was a waste of money. And then I ended up needing it and then I had to pay out of pocket and it ended up costing more in the long run. So I actually have a vlog at my experience at an urgent care facility here in Panama. So you guys can check that out. It's probably going to come out next week because this week's vlogs are already scheduled. Okay. Um, what else? Okay, so this is also a really I don't want to say crazy, but this is another thing that happened to me that I had no idea. If you need to get, so my sister was sick when she came here. She had like strep throat, right? And I'm like, hey, why don't you just get an injection? And she's like, an injection? I'm like, yeah. You know how when you're in the States and you have strep throat, you have to get like a prescription for antibiotics. You have to wait till you have to wait to see a doctor, then get a prescription. So in this particular case, all she had to do was go to the urgent care facility. They took a test, right? And they prescribed her an injection. Now, personally, I love the injections because they work faster. So even if I have like an antibiotic injection or an anti-flu injection, yes, they have anti-flu injections. So if you're suffering from the flu and you want to cut down on your time, you can definitely go to the clinic and they can give you a shot, okay? A 3-day shot and it works. I'm not even lying, okay? I always recommend if you could get the shot, if you are not scared, get the shot, right? So she's like, oh my God, well, I don't know about that. I'm like, girl, just shot. You'll feel better much quicker than you just taking the pills. And you can do that. So one of the ways that you can actually save money when it comes to things like that is that you can actually go, once the doctor gives you the prescription for whatever shot that you need to get, you can actually take that prescription and take it to the pharmacy, buy the medication to get the shot done, and then take it to the clinic and have them give you the shot. So for example, I had to get a shot of antibiotics and at the clinic, they charged me $16 for the shot. So that included the antibiotics plus the administration of the shot, right? When I went to the pharmacy, I actually bought two, okay, of the antibiotic medication, the injectable version, for $9. And it cost me $3 for the nurse to actually inject it. So I actually ended up saving. So if you want to save money, and you want to do something like that, go directly to the pharmacy and get medication versus you buying it from the clinic because it's going to actually end up costing you more money in the long run. And there are like specific pharmacies that you can go to where you can get medication at an affordable price. Now, I know everybody, what I told you guys before, that if you go to the Ray to get the medication, it may be a little bit more pricier, but there are other pharmacies like Panama Value, and there's another one, I forgot what it's called. I will put it in the community tab when I remember, where you can get medication for a discounted price. Even with my daughter's milk, right? So my daughter's now drinking formula. When I went to the supermarket to buy it, because this milk is not sold at every single grocery store, it's sold at like River Smith, the 99. Like it's only sold at specific um supermarkets. Wow, I just had like I was stuck right for a second. Um, it's only sold at specific supermarkets and specific pharmacies. Now, when I went to the supermarket to buy it, the big can was about 20 something dollars. At the pharmacy, it's actually $16.50. So that is also an important takeaway to know that depending on where you are, there are certain pharmacies that you can get your medication cheaper. The most expensive pharmacy that you're going to go to in Panama to buy any medication is going to be Farmacia Rocha, FYI. All right. Was Panama hard hit by COVID? If a person wants COVID vaccine, is it freely available? So yes, well, not now, but before when it was, high, they used to have like little tents set up where you can go, or you can go to the Centro de Salud to get the vaccine. Okay. And yeah, everybody got vaccinated if you wanted to get vaccinated, and it was readily available if you want to get vaccinated. However, now I don't even know where to get vaccinated anymore, unfortunately. All right. So, I mean, I hope I have answered you guys' questions. For now, I'm actually going to take Alexis S. Okay. Advice, and I'm gonna try to get an agent here to interview you guys on that's comfortable enough with speaking English, because a lot of times people don't. Hi, Rick B. How are you? A lot of times they don't feel comfortable speaking English in front of an audience, but if it's a one-on-one conversation, it's not that bad. Okay, so what about getting the yellow fever vaccine? That's actually a really good question, because in order for you to travel, so I'm gonna give you this example. If you are in Panama and you're traveling to Jamaica, for example, you need a yellow fever vaccine. However, if you are traveling from the to Jamaica, you don't need a yellow fever vaccine. And I only figured that out because I had went to Jamaica once, well, a few times. The first time I went to Jamaica, I actually took a flight from Panama to Miami because it was the cheapest flight that was available. And then from Miami, I went to Jamaica. However, when I flew directly from Panama to Jamaica, they needed a yellow fever vaccine. So I actually went to, I don't know if you guys know where Clayton is. In where the old army base used to be, there is a Centro de Salud there where you can get the yellow fever vaccine, and it's like $20. But then I don't know about now. That was a couple of years ago when I had got it done. So yes. So yeah, so that's also something that you guys need to keep in mind, that certain places, if you are going to get certain vaccines like yellow fever, trying to travel to certain countries, they're going to require it. What? It's mad expensive in NYC. I got my cellular and I like to get it. Yeah. So it's pretty simple, guys. You just have to go to the Centro de Salud of Clayton and you give them your ID and you get it done. It's cheap to get it done. I got mine done because I needed to get it done in order to travel to Jamaica. So that's also an FYI important information to take away. And if you have a baby, just know that with certain insurance, certain um, Blue Cross, Blue Cross Blue Shield, for example, all the vaccines are covered except for the flu vaccine. The flu vaccine is not covered with Blue Cross Blue Shield. And it actually is pretty expensive. Well, for me, it was pretty expensive. I think $65 for a shot is expensive. Okay. Again, that's because of the hospital choice, Punta Pacifica. Everybody else told me if I would have went to the Centro de Salud, I would have paid probably like $2. However, I don't like headaches. I don't like to wait long time. Yeah, I don't. Okay, and it's all about like who you know. So that's kind of like difference. Um, but like I said, everything is about it's really a classist system. Like if you can afford amazing healthcare, you'll be treated wonderfully. I know people are scared. Like a lot of people ask me, like, you weren't scared to have a baby in Panama? Um, guys, the last time I checked, the U.S. had the highest rate maternal death rate for African American women. Hello, not Panama, US. So when people ask me such a crazy question, I'm just like, really? I think with medical, with anything that has to do with healthcare, you have to do your due diligence. You have to literally like do your research. I am a research type of girl. Finding a good doctor is like finding a needle in a haystack. And I don't care where you are in the world, okay? Some people really are passionate about what they do, and there are some people that just do what they do because they just want money. So I am reading up on the doctor, um, asking other people about the doctor. You have to literally do your due diligence. Like it doesn't matter if you have and even if you go to some of these amazing hospitals, some of these doctors too are just in for it for the money. So again, you have to literally just do diligence, honestly speaking. But I will say, with my experience giving birth here versus my experience in Panama, I mean, in the States, sorry, I had the best experience here giving birth wise. I've had surgeries here as well. And one thing that I do say about having surgery here in Panama, the doc, my experience only, guys, because I have to keep on saying this, because obviously I'm thinking that if I'm talking, I'm obviously talking from my experience, but there are people that still troll me. So I have to make it be clear that I'm talking from my point of view and my experience. So now from my experience, having surgery, and I've had surgery here times, okay? And the doctor gave me their personal phone number. I was able to chat with them personally. If something went wrong, they were easily like able to squeeze me in for another appointment. So as far as that's concerned, I would say like bedside manner. In my experience, I had amazing bedside manner. I had a surgery in the States, and I was supposed to go for a follow up appointment, and the doctor has yet to call me about the follow up appointment. So, yeah. All right. A lot of retired Americans live in Panama. I would think some insurance company must accept them. I don't know. My father is retired. And they don't take his insurance. He had a very good insurance, and they don't accept his insurance here. So I think it pretty much has to do with like if you are in the military. I know that they are trying to do something with insurance with the states and merging it here with insurance here in Panama, but that's something that has not been done as of yet. Everyone that I know that have health insurance from the states, they actually have to go back to the states to use their health insurance. Okay. And that's part of the reason why other people are leaving Panama, especially older people, is because of health, the cost of health insurance. Yes, the cost of health insurance is way cheaper than it is in the States. But if you have certain type of conditions that require you to either have surgery or you have to have, something consistent, you would have to go back to the state. My uncle had to go back for dialysis. Okay. And he had amazing insurance, but unfortunately, what he needed to get done, he couldn't get it done here. So he had to go back to the States. And there are a lot of other people too. I know someone right now who has to go back to the States for surgery because some things just make sense, guys. If you have insurance that is willing to cover you 100% for something, whatever it is, and you have an option of even if you pay for a ticket, right? Even if you're paying for your flight and it still comes out cheaper. For example, let's say you have to have back surgery, okay? The back surgery in Panama is costing you $5,000, and the back surgery in the States is costing you nothing because it's fully covered by insurance. Even if you take a flight and buy your plane ticket, it's still coming out to be less cheaper, okay? So that's something else to keep in mind also. The only thing is that sometimes you may not want to stay for the aftercare. I've had wonderful experiences here, for the most part, attending hospitals. If I didn't have to come out of my pocket, Honestly speaking, I would have had my kidney stone removal here versus me going back to the States. And trust and believe, I'm sure there's many people in here in Panama that had kidney stone surgery, okay? And they're not paying $5,000. However, it all depends on where, who, what, when, why, and what you're accustomed to. You understand what I'm saying? There's insurance for U.S. Panama Canal retirees that is accepted in Panama and the U.S. Well, that's kind of different because most people that worked in the Panama Canal, they worked in Panama, but they were working under the U.S. government. So that is kind of different. I'm talking about like average people that are retired, like people who did not work for the canal. Um, so yeah. I mean, there's always an exception to the rule. Right? There's an exception to the rule for everything. However, most people who are retired and moving back to Panama did not work for the canal. I'm not saying everybody, okay? Of course, there's an exception for the rule, but most of the people that I know that are retired from the States did not work for the canal. I'm literally just talking about people, regular small people that had regular jobs and retired. Anyway, guys, I hope that I have answered your questions to the best of my ability. The next time we meet, I will try to have an insurance broker here to uh, interview so that you guys can answer some questions as well. Um, yes, Blue Cross Blue Shield has Shield Blue, which is their international version of global health insurance. You can choose to add U.S. coverage to the plan, or you can have it without adding the U.S. coverage. Now, I will say this: I have tried to use Blue Cross Blue Shield in the States, and they denied my claim. My experience. My experience. So, but I ended up using my other insurance, so I never really went deep into it. I probably should have investigated why they denied my claim. However, they did deny my claim. So that's just something that you should know. I don't know if it's the way they put the claim in because Panama is very one-minded. Like one, they I can't not one-minded. I can't say that they're one-minded. That's not what I meant to say. So that's not what I meant to say. What I'm trying to say is that the people that work in these services, it's pretty much black and white. Like there's really no gray area. So if it's not this, then it's that, and then your claim will get denied without doing future like more research on it. And that's probably what happened. But I had, like I said, I had private health insurance in the States as well. So I never really looked into why it was denied. Maybe I should. I should look into that and then come back with an answer for you guys. And again, I'm only talking from my experience, guys. So I don't want you to feel like what I'm saying is it's black and white. This is literally just my personal experiences, things that I've gone through. Okay. You still have to go through your own process. My mom always say dog and cat don't have the same luck. So, this is just something to keep in mind. This is just my experience. Okay. So, I want to answer a few questions. If you guys don't have any more questions, just let me know in the comment section. If you're clear, I definitely am going to try to get the broker on here. I'm going to hit him up tomorrow and ask if he's willing to do it. Thanks for sharing your experiences and info. There's a there are important they are these are important topics people stay speaking on, and only sunshine and rainbows. No, yeah, no, I totally understand. And being here for so long, I have experienced many things, and I didn't literally have anybody to guide me during any of these processes. Like everything that I've learned is because of trial and error. Um, my situation was a little bit different from most people because most videos that you see on YouTube are people who are retired, right? They are retired people. Obviously, I am not retired. Okay. I mean, I wish I could, but I can't. And so And then on top of that, I am Panamanian as well. So my experience from most other people were pretty different, you know. I grew up in Brooklyn, New York, and I didn't see anybody from Brooklyn, New York at the time I was in my 20s. I didn't see anyone with those experiences, like the experiences that I had. So it's really important to me, wow, to share these experiences with you guys so that you can take what you need to take from it and leave whatever else you don't need. Take what you need and leave whatever else you do not need. I only can talk from my experiences. Maybe you may come down here and your experience might be completely different. Things have changed, you know, since the first time since 8 years ago when I first got here. Things have really changed. Like Panama has improved so much when it comes to certain things, and there are certain things that they are behind on, like changing my daughter's name and taking off the third off of it, but that's a whole nother story. But anyway, um, so yes, I hope that this found this. I hope that you guys. Wow, I don't know why I can't talk today. Like, I think it was because I literally like ran home to you guys this live, because I was almost not gonna do it. However, I hope that you guys found this information extremely useful. And if you have any other questions, leave the questions in the comment section, guys, because by you leaving questions in the comment section, we have topics that we can discuss, topics that you guys want to hear and to talk about, right? I love your videos. Can you tell me which hospital there is affiliated with John Hopkins? I can't remember. It's Punta Pacifica Hospital. Okay. That's affiliated with John Hopkins. Punta Pacifica Hospital. They are affiliated with John Hopkins. That is where I went to have my baby. That is where I had the amazing experience. That is where I still go to for regular checkups. My kids, that is where we go. They have amazing service. And my copay, though, is $20, just so you know. The average person, okay, cannot afford a copay for $20. Okay, just to keep that, I just want to, you know, be mindful of that and be respectable, because a lot of times, you know, I have my cousins and, you know, my family members that are local people, and they follow me, they come in my lives, and I don't want to be like, oh my God, that's so cheap. You know, everybody can afford that. What's cheap to you may not be cheap to other people. So, yeah. And a $20 copay is definitely what I was paying in the States as well. Like today, I had to take my daughter to the hospital, not the hospital, but she had an appointment and her copay was $20. So, at that hospital. I swear you're my Panama Connect. Girl, that's okay. You know, you have any questions? Guys, if you have any questions, leave it in the comment section, okay? We've been on here for about how long we've been on here? Almost an hour. So I am going to head on out because my baby needs me, my kids need me, okay? And my baby daddy, no, let me say, my man is ringing my phone. So I am going to check you guys later. Thank you guys for tuning in as always. Please make sure before you leave, make sure you hit the like button. If you came in late, catch it on a replay. If you know anybody that has this information, share it with them. Okay, share. Okay. And I will see you in the next one, guys. Check out my latest vlog that I did yesterday. I have another vlog coming out tomorrow. I have another vlog coming out on Thursday, and I have a live that I'm doing on Friday. So I have a lot of content coming out for you guys, okay? So please put on your post notifications, sign up for the mailing list at vgirltv.com, okay? vgirltv.com. Sign up so you never miss a update. Thank you, everybody. Everybody, thank you. Anyway, peace and love.